Spina bifida is a neurotube defect that occurs because there is a defect in the closure of the neurotube. Neurotube closure, which somebody would call a spinal cord closure, occurs extremely very early in pregnancy. Neurotube closure occurs by 4th week of gestation. That is 6 weeks after the last normal menstrual period. And oftentimes that closure occurs when so many mothers have not started attending antenatal clinic. And the commonest cause or the factor which has been attributed to neurotube defects in neurotube closure has been folic acid deficiency. And that means that folic acid should be commenced extremely very early before somebody conceives. The recommended time to start folic acid supplementation is 3 months prior to conception, or even earlier for some other mothers who have special cases. There are conditions where neurotube defect is more significant in patients who are obese, patients who have other medical conditions like epilepsy, and then there are patients who have had history of also spina bifida or neurotube defects prior in their family. Those categories of patients would probably need to commence much earlier than the rest of the people. The recommended dose of folic acid is about 400 micrograms daily, and that means that this should be commenced extremely very early. And besides having folic acid supplementation, there are foods which have higher folic acid compared to others. In most of our settings, foods like liver, spinach, fortified cereals, rice, if we talk about lettuce, broccoli, spinach, black eyed cowpeas, those are some of the foods which extremely have very high levels of folic acid. But there are also nice foods we like the chicken breast, ground meat. Those ones have extremely, the eggs, milk, they really have very low levels of folic acid, although they can provide other nutritional benefits like calcium. So oftentimes those are some of the considerations which we should take while having folic acid supplementation. Neurotube defects are of 2 types. There are those which are cranial, meaning that it affects what we would call as the brain. Meanwhile, there are those which are spinal. And usually it depends on the level and the time when the defect has happened. Oftentimes, some of the defects which happen lower in the spinal cord can be corrected, usually with minimal side effects. But usually if somebody is having a cranial neurotube defect, some of them are extremely so severe and they can affect they may not be compatible with life, because, for example, if somebody's had anencephaly, meaning that the brain development is limited, it may be extremely very difficult for them to be able to survive without a brain function. That's why we encourage that every mother should start taking once you plan to conceive, you need to start folic acid supplementation early. And if you have any other medical condition such as diabetes, or if you're obese, if you're taking anti-epileptic drugs or some even other antihypertensive drugs, it will be very important that you consult with your physician early, and then you start having the supplementation early. So that is with respect to when folic acid supplementation should start.